And we are live. Welcome, ladies.
Hello, and
Hi.
welcome everyone to the Melanin Initiative. I'm Alicia Brown, and one of your co hosts for the Melanin Initiative podcast. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking up too much of your time. So today we have an extra special episode for you where we will be talking about sexually transmitted infections or STIs, formerly known as STDs or sexually transmitted diseases. We'll also be sharing with you information about the most common STIs, who's at risk, how the diseases are transmitted, and your testing and treatment options. Now, as a reminder, this show is for educational purposes only. The opinions expressed are ours alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. So we're going to start with a definition, right? We got to tell you what will give you a lay of the land. So sexually transmitted infections are the infections you get from another person through sexual contact. According to the CDC, there are more than 20 known types and over 20 million people in the United States that are infected each year. Half of these people are aged 15 to 24, but anyone participating in sexual activity is at risk. Luckily, most STDs can be treated and cured. Now, most of the common STIs and STDs that you're going to hear about are chlamydia, gonorrhea, syphilis, genital herpes, acquired immune deficiency syndrome, which is AIDS, hepatitis B, genital warts, and trichomoniasis. So, Geraldine, why don't you start us off with talking about what you're seeing in your clinic in relation to STIs? From my personal opinion, it feels like STIs or people are feeling like STIs are a thing of the past. But I know you've shared some interesting stories with us. So, what are you seeing out there?
So yeah, it is definitely not a thing of the past. A lot of times it's probably like 20 to 30% of my day visits. I oftentimes have patients coming in for STI testing. Usually it is that age range, the younger age range, the young adults. However, I've also had older adults coming in their 60s and 70s for STI testing as well. And I'm glad that they are coming in because people automatically assume that that population is not sexually active, which is not the case. They are, and they are definitely still, because they are having sex, they are at risk for contracting a sexually transmitted infection. Um, a lot of the most common thing I tend to see in clinic is chlamydia and gonorrhea. And it definitely if you're having any like burning with urination, if you're a male, or penile discharge, or as a woman if you're having burning with urination or you're having abnormal discharge, a lot of times um it can it can be multiple things. STIs tend to, gonorrhea and chlamydia tend to mimic each other as far as your symptoms are concerned. So it's very, very important that you come into a clinic and get tested. Other symptoms can include like painful intercourse, men or women. For women, they may have painful periods, pelvic pain, itching or burning in or around the vagina. With men, they can have the burning sensation when they're urinating, or pus coming out with the urine. All bad, all like negative signs, or signs that you should come in and get tested. Once again, in the clinic, typically what we're seeing a lot more of is chlamydia and gonorrhea. And I also want to note that sometimes people don't have symptoms at all. So if you're sexually active, it is super important that you are getting tested frequently, or more routinely, especially if you are having unprotected sex. And also another thing I wanted to point out, a lot of things that I'm seeing in the clinic as well, is that it's not only in your genitals. You can't. It's not specific to the genitals. People have been coming. I've been seeing patients with gonorrhea and chlamydia in their rectum. Among the patients of men who sleep with men, you can definitely contract gonorrhea in your rectum. We also do testing for that there, where we swab the rectum, send it off to the lab, and if you, the treatment is the same as far as the antibiotics is concerned, but And you can also have it in your throat. People that participate in oral sex can contract gonorrhea and chlamydia in their throat. So once again, if you're sexually active, it's just very important that you are paying attention to your body, paying attention to your symptoms. And even if you're not symptomatic, getting routine testing. As far as treatment options, when in the clinics, once again, the common things is, the common STIs that I see is chlamydia and gonorrhea. And with chlamydia, it's usually treated with a antibiotic called doxycycline that you take twice a day for 7 days. And we always tell patients it's very important that you are abstaining from sex during the treatment. And then also it's very important that you are notifying your partners, or if you have multiple partners, you notify everyone so that they can also get tested. Because if you don't tell them and that's your partner that you are always having sex with, and if you had it and they have it and you get treated and they don't, guess what? You're going to get it again. So you guys are going to just keep passing it back and forth to each other. So it's always important that you and your partner get treated at the same time so that you can kind of get rid of the infection. With gonorrhea, we typically do an injection in the glute, which is your butt muscle, called it's a antibiotic called ceftriaxone, and it's a one-time injection to cure gonorrhea. And then some of the other things like trichomonas, also I see that every now and then as well. It has a different set of antibiotics, but a lot of these tests we do with urine testing. Also in the clinic, we test for HIV, hepatitis B and C, syphilis, through blood test. And so that's kind of like, it's like I said, it's a kind of I see a lot of that lately. I've been seeing a lot of it in the clinic, and I'm happy that people are coming in and not just kind of like walking around symptomatic and just thinking, hoping, wishing that it's going to go away, because it's not. If you have an STI, you need treatment.
So I have a question. So say I came into your clinic and I was having itching and burning and pelvic pain. Would you run tests for everything, or would you just run tests for what you're concerned about?
So I personally offer testing for everything, especially if you're sexually active. More so, I'd focus more so on what you're having symptoms on. Like, for example, like if you're having burning, vaginal itching, discharge, things like that. It's important if you're sexually active to have STI testing. Typically what I do for a female patient is that we'll do a pelvic exam where we look, insert a speculum into the vagina, look and see what's going on, assess, let's see what the cervix is looking like. We assess if there's discharge in the vagina or a discharge coming out of the cervix, and we do swabs. The swabs that I typically do from the cervix is for chlamydia, gonorrhea, but I also test for bacterial vaginosis and yeast infections. Although those are not STIs, they can also cause those similar symptoms that STIs can cause, like the like a fishy smell with bacterial vaginosis, which can, or like the abnormal discharge that you'll see with trichomonas or chlamydia. So I typically test for everything, and some patients tend to not want to get their blood drawn, but I'm always like, for the HIV and the hepatitis B and C, but I also put it, I kind of like put it as, if you are concerned about the other things, you should also be concerned about these things, because you don't, you want to be sure that you don't have HIV or syphilis or hep B, hep C, things like that. So I typically try to get them to test for everything just to be on the safe side.
Wonderful. Okay. Thank you. So I'm still your patient, and I'm wondering to myself, well, that sounds great, but what can I do to even prevent myself from getting all of these things? We enjoy having sex, I, have a boyfriend and we do this, but I don't even want to get an STD or an STI. How do I prevent this?
Well, you can use condoms for one. That's like probably one of the most effective ways to prevent STIs. Sometimes using condoms seems to be like the unpopular opinion among folks nowadays. And if you are in a monogamous relationship, then, and that the two of you are in a monogamous relationship, I guess not using condoms is okay. However, you never know what the other person is doing. And I've had patients come in and they thought that they were in a monogamous relationship, and then they contracted an STI because one person stepped out on the other. So I always would tell patients like proceed with caution as far as that's concerned. You and especially patients that are high risk, like the men who sleep with men or multiple partners. I always recommend PrEP. I have patients come in and they're getting tested for, whenever they come in, let's say a patient is not on PrEP and they're sexually active and they're high risk, I always offer them the option to get on PrEP.
Okay, ladies, let's slow down.
Mhm.
So let's back up a little bit. So you mentioned they're going to come visit you and get testing. How do they schedule that appointment without giving away, while maintaining their privacy?
So with our interface, they just schedule for it just says women's services, men's services, and that could be anything because somebody can come in with a rash down there, and it might not necessarily be an STI, but it does not appear anywhere when they're checking in. When they come in, I know what it is because it pops up on my screen. But then I always ask them, "Hey, what are you? So what brings you in today?" And then they tell me what they're coming in for, and then we go from there.
Okay, so now we're going from there. Am I wearing a gown? Like, what does the exam actually entail?
It depends on if it's male or female. So with the male patients in the clinic, typically we do a visit, we get history, we ask about sexual practices, if they have more than one partner, if they have male and female partners or just male or female. We get a rundown of their sexual practices, and if it's a male patient, we give them a cup to provide a urine sample. And there's not really, as far as testing is concerned, because they're just giving me a urine cup, I'm not really wearing a gown. However, I'm wearing gloves if I'm touching anything. And then I draw their blood also wearing gloves as well.
Well, I meant the patient. Do they have to get undressed? Is it going to be painful?
Yeah. Okay. So good question. So for the female patient, yes, especially if they're symptomatic, then it's highly recommended that we do a pelvic exam. So there is a drape that we can kind of have them get on, because in the room that I'm in, it's a one clinic room, but we pull the drape, we have them get undressed while we set everything up, typically just from the waist down, and then we give them a sheet to cover themselves to provide them with as much privacy as possible. Typically, I tell patients, I give them a rundown of how the visit is going to go. We also offer them the option of having a chaperone in the room if they don't feel comfortable with it just being me and them. Oftentimes, if it is a male provider performing a pelvic exam, or even if it's a male, if it's a male provider performing an exam on a female provider, they have to have a same-sex chaperone in the room. And the same for male. Like if I have a male patient and I'm examining their genitals, I offer the option for them to have a chaperone in the room as well, just so that they feel comfortable. But yes,
A
it doesn't.
chaperone is the same gender as the patient, or is the provider?
As the patient.
Okay. And is it painful?
No, it's usually not. It's not painful at all. I always tell patients, if we're doing like with a pelvic exam, we insert a speculum into the vagina. It should not be painful. It's probably a little uncomfortable because you're not used to having like a speculum there. So I always want, tell patients, hey, you're gonna feel. I kind of walk them step by step of what they may experience, so it can kind of help lessen their anxiety about the exam itself. So inserting the speculum, I tell them, hey, you're gonna experience a little bit of. You might experience some pressure, but the more relaxed you are, the easier it is to perform the exam. So that usually kind of does the trick. It takes a couple of seconds. We take the swab. We probably do 2 or 3 swabs, and then it's done. And then we also do a bimanual examination to assess for like pelvic tenderness, which involves inserting the finger into the vagina and then pressing on their abdomen to assess for tenderness in their abdomen.
When you're swabbing, what are you swabbing?
Mm-hmm. Yeah, good question. So for chlamydia and gonorrhea, we are swabbing the cervix for chlamydia and gonorrhea. That's how we use the test. And then for bacterial vaginosis and yeast infections and trich, there's a swab that does all 3, and we just swab the vaginal wall. We don't go all the way in, but we go at least 2/3 into the vagina to swab and try to get discharge on the swab.
And then we talked about discharge. We might have some teenagers who don't know what that means. How would you explain that?
So with If we're talking about female discharge, it's some women, it's natural to have discharge. It's kind of like our the woman's body, the woman's vagina's way of kind of cleaning itself out. It's you probably heard this term before, that the vagina is a self-cleaning oven. So very, very important that you do not douche, because you can throw off the balance in your vagina. So some discharge is normal, and everyone is different. What might be normal for one person is different for another person. When you should be concerned is when it changes from your norm. So let's say you start to have more discharge than normal, or the discharge becomes itchy, or like let's say it's normally like thin and watery, and now it's thick and clumpy and itchy. That's when you should be concerned. But just if you have discharge, that like some people think that, oh my gosh, I have discharge, is abnormal. Not necessarily, because it is our body's way of kind of cleaning itself.
So you talked about cleaning itself and douching, and you're telling me that, and I hear you, but when I go to the store, I see those products are on the shelf. So why would they sell something if I'm not supposed to use it?
To be honest, I don't know why it's on the shelves. But like I always tell patients, it will throw off your balance, and it actually increases your risk for having not a STI, of course, but for having like bacterial vaginosis or yeast infections. But
So
it's
how do I stay
highly
clean down there if I'm not using one of those products?
warm water. Wash it with warm water. They do sell like those washes, the pH balance washes. I always kind of tell patients to be cautious with that, because it can also affect your pH balance, but you should not insert anything up there to clean it, because it's cleaning itself.
Perfect.
So, okay. I actually another question for you. So after we do all of these exams and you run your tests, well, how long should I wait for my results to come back?
That's a great question. So, depends. So, in the certain clinics, they have certain facilities, they have what's called point of care testing, where they can get test results within minutes while you're still there. So, during your visit, they can get the results. A lot of times, blood work, though, you can't get the same day. We typically have to send that off to the lab. And it always depends on the lab itself. Typically, the blood, if we draw blood, or we do like the swabs for the pelvic exam that we send off to the lab will pick it up. And it just depends on the lab and how busy they are. But in my experience, I've had results come back in like a day or two. But sometimes it can take up to like 5 days for results. Now, if you are, let's say you came into the clinic and you came for STI testing, and let's say you had exposure and you're having symptoms. In addition to testing you, I start you on antibiotics, because you had exposure to, let's say you knew that your partner has chlamydia, you're having symptoms, it's very likely that it's possible that you might have it. We don't wait for you to get your test results before starting you on the antibiotics. You start on it immediately.
Alrighty. So, Kimberly, what are you experiencing out in the community as well? Do you see any potential people that are at risk, or any other things that you're seeing in the community that you'd like to share with us?
Sure. Okay, so we're talking about who's at risk.
Yeah.
Anyone who participates in sex is at risk.
Mm-hmm.
Anyone who participates in sex and is unprotected is at risk, regardless of your age or your body parts. So when we look at pregnant women, that's not a protection against developing an STI or HIV.
Mm-hmm.
They're still at risk, and there is a chance, depending on what you have, that you can actually pass it on to your fetus in womb or during labor. Our older adults, I'm so glad Geraldine touched on this, right? So the older adults, they already know that they still want to get out and have a good time. What I find is the challenge is the family doesn't believe it. They don't even want to talk to me about it. And I'm just trying to tell them that, things are different nowadays. There's a whole thing called actively aging. These are our adults who are still thriving. They're still socializing. They still have dreams. They still travel, and they still want to date, and they still want to experience pleasure. And so we see a rise in STIs in our older adults because nobody's talking to them. And so they're not in the window of getting pregnant anymore. And so sometimes we forget that they still have risk. And those are all the STIs that we've already mentioned today. And so I guess that could be a sensitive conversation to have with mom or grandma, but it's an important one because they're older. Anytime we talk about infection, they're going to be at higher risk for complications associated with those infections and associated with those treatments. And so Geraldine mentioned antibiotics. And one thing we would love to emphasize when we talk about antibiotics is two things. First is something called stewardship. We only want to prescribe antibiotics when it is appropriate for the right patient at the right time for this specific amount of days that's required. If you're prescribed antibiotics and we tell you you need to complete this prescription, even once you feel better, we need you to do that. There's something called antibiotic resistance, which means that at some point, if you keep taking antibiotics, you take antibiotics, they don't know what's a good or bad bacteria. We already have good bacteria that we want to keep. It's fighting off stuff right now that I don't even know about. But when I take an antibiotic, it kills everything, right? And then the strongest ones survive, particularly if I don't finish that antibiotic. And so now we have 3 medications we can offer you. But the more we build resistance in the community, now these 3 aren't going to work anymore. But I have to go back to the lab to come up with some more. And that's going to take a very long time. And we want to avoid that because we can run out of options. And that's what we see a lot in the hospital. So I want to just touch on our LGBTQIA plus community. June was Pride Month, and we have celebrated all month long. If you didn't have a chance, please go back and watch our episode with Deputy Director Kenya Hutton, where he gave us a wonderful rundown of the history of DC Black Pride. So Alicia and Geraldine talked about the visit. And so, right now I'm going to talk to both our patients and our clinicians when it comes to the visit. We want to do a few things. We want to make it comfortable and inviting. So we know that our LGBTQ plus patients experience, unfortunately, a lot of harassment, and they're just flat out denied care in the healthcare setting. And sometimes it starts right at the door. So we want to make sure they feel welcome. The beginning of that visit, you should keep your clothes on. Have the discussion with the provider about why you're there and what's going to take place during that exam. The provider should then verbally explain what's going to happen before they actually do it and get permission to touch those body parts. Only the body parts that you're actually concerned about should be included in the visit. Everything else can be addressed at another time or ignored completely. Some other things, the chaperone was very important, and it's important for the provider to find out what your pronouns are and to use them and to disclose what their pronouns are as well. And then if the patient describes body parts a certain way, it's important for us to use that same language. So if they're not going to say breast or pregnancy test or birth control, then I need to also use the words chest or bottom procedures, bottom growths. I need to mimic what my patient's saying so that they feel comfortable. So in our LGBTQ plus community, just identifying as that does not put you at risk. Pretty much they are at the same risk as everyone else. Your risk increases based on your anatomy and your behavior. And that's everybody, right? So one thing we do know that in healthcare, we don't ask these questions enough. And so we actually don't have enough data to always say, to report on what we're seeing in that community. And so I think you're going to start to see changes in that, particularly when you're registering for appointments. You're going to see things like what was your sex assigned at birth? What is your gender identity? What is your sexual orientation? Have you had any gender affirming treatments or procedures? We want to respect our patients. We don't want to re-traumatize them. And so there is a certain way to ask these questions and to get that information and to make sure that when we do conduct research, we make it easy and comfortable for those patients to be included so that we can evaluate the outcomes, make sure that we're giving them the right treatment and that it's actually working. So then we're going to talk about some medication. So we know for instance, we know our men who sleep with men are at high risk, in particular for HIV and STIs, but anyone who's sleeping with someone who is known to have HIV, they can take a medication called PrEP, which is prophylactic, right? I already know I'm going to be exposed, so I'm just going to take this medication. It's going to lower my risk. So that's if you're having sex with someone who's known to have HIV, and this is condomless sex or unprotected sex. But we also know people, if you're having unprotected sex with someone who has an unknown status, then you also qualify. So you might take that pill every day. There's also exposure prophylaxis. So if you know you just had sex with someone, and the after sex they admit, oh, by the way, I'm positive, or oh, I don't know my status, or you yourself are concerned, within 3 days you can take a medication. You'll take one dose within that first 3 days, and then another following 2 more after that, following that, and that will lower your risk. None of these are cures, but they significantly lower your risk to the point that you might not develop HIV or AIDS. And then there's vaccinations. We did mention, excuse me. I noticed like I lose my voice in all of these. I either lose it or it starts cracking. I don't know. So I got my little T here because it's like, singers, they do it. And because they're using their vocal cord on claim to be a singer or hold a note. But I can drink this tea. So yeah, with our vaccinations, we mentioned all these STIs, and hepatitis B, which affects the liver, is also a sexually transmitted infection. It can also be passed from mother to baby. And really where we see it a lot is in our patients who use IV drug use, which is why so many communities have these wonderful programs where you can turn in your used syringes and get clean ones. No questions asked. We just want to keep everybody safe and lower the transmission of infection. I think that's all I want to say about risk factors.
Great. I think listening to both of you speak, I think something to bring home for our audience is that we know this is a very uncomfortable topic to talk about. You don't have to feel embarrassed, but it's mainly you have to communicate and speak up and talk to your provider. It doesn't even have to be your primary care. You can go to urgent care. You can go to clinics. You can go. A lot of these things can be tested very quickly, and you don't have to wait a month for a primary care provider appointment.
Yeah.
So the sooner, the better. It's better to get these things treated. A lot of them can have longer term effects if you don't get them treated fairly quickly. So it's important to say something. If you see something or smell something or feel something, say something.
Yeah, oftentimes it's good that you brought that up. I get a lot of times I get patients coming in and they're like, "Oh my gosh, I'm so embarrassed," and I'm like, "I'm not here to judge you. That's not what I'm here to help you." So, what you do in your, what you practice, that's your business. However, my job is to keep you safe, and give you options on how to keep you, how to treat you, one, and then how to go forward to help prevent this from occurring in the future. So it's very, very important that you are transparent with your provider, because some people don't want to, say that they have multiple partners. And if you do, it's better to disclose that so that we can know how to better assist you, or what advice that we can give you going forward as far as protection, prevention, and all of that.
Yeah, and I think Geraldine displayed really some wonderful qualities of a provider. She explains what's going to happen. She made a really uncomfortable environment. She gives you the opportunity to invite a chaperone. If you happen to be in a setting where that's not happening, you can ask. You can say, "Hey, please just explain what you're going to do before you do it. Do it respectfully." And that's one of your patient rights. You always have rights as a patient. And Alicia brought up a good point about, is everything going to be included? I remember when I used to get when I was in college and I was getting tested frequently, just because it's around and you just worry. I remember someone told me, we're not actually checking for everything. So there was a catalog of things that are included, but if you wanted to be tested for HIV, that was separate. You need to actually ask about that.
Yep.
So that was a good thing that you brought up.
Yeah.
And that's still the case. But me, I because of the nature of the visit, I automatically say, "Hey, can we do this as well? Do you want to do this as well? Because you're here and I can do it." But you are absolutely right. It's not always offered. Some providers or some facilities will focus on just what you're coming in for.
Yeah. And then you had mentioned before, you had offered the patient a test that was going to require a shot, and they didn't want to do it. Did you want to talk about that?
Yeah, so I had a patient come in, and the patient came in for STI testing, but symptomatic. He ended up having, I don't remember what it was, but he ended up having either chlamydia or gonorrhea. And because the fact that after our conversation, I noticed that he was high risk, I offered him the option of us starting him on PrEP. However, he was a little hesitant because when you are on PrEP, it does involve you. That's the medication that you take daily to lower your risk of contracting HIV if you're having sex with a HIV positive patient or someone of unknown status. But that because if you're on that medication, you have to get your blood drawn every 3 months to ensure that one, we test for HIV, and then we look at your kidney and your liver function just to make sure that the medication is not having a negative impact on your kidney and liver. And that was kind of like that threw him off. He didn't want to have the blood work drawn every 3 months. But I also said, I'm like, if you're going to be sexually active, would you rather have HIV or just get this stick that only takes a couple of seconds every 3 months? It's not like you're doing it every week. So I completely understand that people have fear of needles. However, I think it's better than risking contracting HIV and having to be on medication for the long term and having to get more blood work done because you do have HIV. So
Exactly. And because of the Affordable Care Act, you can get PrEP for free, and all the visits associated with it and any lab work associated with maintaining that prescription are also free. And HIV can still be a very scary word to hear, particularly if it's coming at you. But we've come so far in our medications, and that people who take the medication and take it as prescribed have been able to lower their numbers so much it's not even detectable. They still take their medication, but also they haven't been progressing to AIDS, which is kind of like there's still options there, but it's really kind of the end there. So, and it's avoidable.
yeah.
And so I think someone had mentioned, we were talking earlier, sometimes people are they don't want their family to know that they're either getting tested or taking medications. And we see that a lot, particularly in our community. And there's ways around that, but really just think about what's on the other side of that if you don't do it. It can be really much worse if you don't. And we talked about partners earlier. You really have an ethical obligation to tell your partners, even if it didn't work out, even if you don't have, if there's harsh feelings between you two, there's ways to get that information to them because you can protect the next person. That's all I have.
Well, that was great, ladies. I feel like we touched on a lot.
I showed that dental dam, but we didn't say anything about it.
Let's go back.
So here we have at the top, we have the body parts of a female. Sometimes people, even women, have never looked down there. They don't even know what's down there. So we have that first word, urethra. That's where urine passes through. And then we have the vulva and the vaginal opening, which I think a lot of people think everything happens through that opening. And that is not the case. That is typically where penetration will occur, and then you can see your anus. And since we're looking at the anatomy, anytime we're wiping, because she mentioned yeast infection, we always want to wipe from the front. So that's the front of your body to the back. Think, is there something like something in the front, party in the back? Anyway, it's dirty in the back, and the front is sterile. So we want to wipe from front to back. And this is another thing that puts our older adults at risk, because as you get older, reaching to the back, you take that for granted. But as people get older, becomes very challenging. And so a lot of times they wipe from the front and they're bringing it from the back to the front. And that's how they get that urinary tract infection or yeast infection so much more frequently than in our younger population. At the bottom is a dental dam. This is similar to a condom. It allows you to participate in oral sex safely. Okay. And you can still transmit sensation through there. That's one of the number one reasons people don't want to use condoms, is because they feel like it's going to decrease the sensation. And we hear you. There are different types of condoms out there, but again, at the end of the day, it's all about avoiding those complications. And you can still have pleasure, and you can get used to if you try different things, you can get used to them.
All righty. So we definitely discussed a lot today. So our takeaways for today, we talked about that STIs are sexually transmitted infections that people get by having sex, unprotected sex. We learned that the most common types of STIs include chlamydia, gonorrhea, syphilis, genital herpes, AIDS, hepatitis B, genital warts, and trichomoniasis. And then we learned how these diseases are transmitted, and that anyone at any age is at risk, especially if you're sexually active and you're having unprotected sex, you are at risk of contracting an STI. And also, we discussed what treatment options are available for treating the STIs and for preventing HIV, such as PrEP. I want to note that I want you guys to be sure to check out the description box for a list of resources. Our email is also there. It's tmi.melanin@gmail.com. Make sure you subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Tell a friend to tell a friend. After today's episode, make sure you also tell your grandparents and your favorite retired adults. Remember that we release a new show weekly on TMI Tuesdays at 10 a.m. on YouTube and all of your favorite podcast apps. Be sure to check the description box for our social media links and a list of resources related to our conversation today. Follow, like, and share our content with all of your friends. Thank you for watching. Bye.
Thanks, everyone.